Welcome back to Raising Joyful and Resilient Black Children, the podcast where we explore the tools, stories, and conversations that uplift the health and wellness of Black families. I'm Dr. Valerie Adams-Bass, and I'll be hosting today as my co-host, Dr. Sharita Butler-Barnes, attends to her family. We are so excited, I am certainly, as well as my co-host in her absence, to bring you today's episode. We're focusing on sexual health, community wellness, and empowering our families with knowledge and support. Having said that, today we are joined by a special guest, Ori Bailey, Prevention Education Navigator of BEBASHI, Transition to Hope. BEBASHI has been serving the Philadelphia community since 1985, and we're honored to have her here and to learn more about their work and how they support Black families and youth. Welcome, Ori. Welcome to the podcast. We're very glad to have you here. Very glad to have you here. Thanks so much. We have been looking forward to having this conversation with you. Before we get started, can you tell us what BEBASHI stands for? I think it's an acronym.
It is an acronym. Okay, so BEBASHI stands for Blacks Educating Blacks About Sexual Health Issues. I was just at a community event the other day. I think it was Saturday, but I learned that BEBASHI is also another term in Hindu. I think it's Hindu, and it means peace. Like, please bring me peace. It was really interesting, but yeah.
Very interesting. Very interesting. Learn something new every day. Well, let's start by taking a step back in time because BEBASHI has been doing this work since 1985. Can you share a bit about the organization's history and how its mission has evolved to support sexual health and overall wellness?
Absolutely. So, like you mentioned, BEBASHI has been around since 1985 when the AIDS epidemic was at its peak. So, our founder, Dr. Rashida Abdul-Kabar, yes, she saw individuals within the Black and Brown community either being rejected or not having any connections to care, and thus has harmed our people, and many has lost their lives. So with that being said, she had founded BEBASHI, and that's where we have been honing in on HIV care and prevention for those who are at risk of HIV.
Okay, that was a big task and a big ask at that time, and so glad that you're still here serving the community at large. So, Ori, in addition to sexual health services, BEBASHI provides a wide range of support to the community. Can you highlight other programs or services and how they work together to address broader health and social needs?
Yes. So other departments that we do have under our organization is medical case management and housing for those who are living with HIV, our food pantry, which is like a grocery store-like pantry, and we have our own wellness center. But not only that, we do have a clothing boutique that is for those who are both masc or femme presenting gender affirming items, our own in-house pharmacy, and I think that's all of our programs for real.
That is more than enough. That's plenty given where BEBASHI started. So thanks for sharing all those services. With the evolution of services that BEBASHI offers, can you give us an idea of how BEBASHI identified these additional needs and decided that they will offer services beyond testing and counseling, like the food pantry, like the clothing boutique? How did BEBASHI decide that we need to be offering these services as well?
So it's far beyond the sexual education. And we noticed that there are other factors within somebody's life that could affect how they are taking care of their health and everything. So a lot of our people who are within the Black and Brown community may be experiencing poverty, having struggles with getting the food that they need, getting connection to care. We do help those connect to health insurance as well. So we wanted to provide that space and those, I wouldn't say opportunities, but the care that they deserve.
Sure. So having access to the resources, and I'm glad that you added that you also help to connect with healthcare and also health insurance. So thanks for adding that as another asset that BEBASHI offers, another form of support. Thank you. So in your role as a prevention education navigator, you are rooted in the community. How do you engage with the community, especially with Black families and youth, right? We are talking about raising resilient and joyful Black children. And we know that children are sexually active, even if parents, myself being a parent as well, don't necessarily know how to have that conversation or support our children once they engage in sexual activity. So I'm just wondering, especially with Black families and youth, how do you provide education and resources and support around sexual health as a prevention education navigator?
We do tabling, educational workshops, and presentations out into wherever we are, we go. From my experience being within the schools, we treat the lesson as a conversation. We want to meet the kids where they are and not have it to be a long, drawn out, boring, just to see what they know, to teach them what they don't know, and to make it all a comfortable space, because we all know, we all have been teens before. We've all had our emotions. We've all had,
Yep. Yes.
We got to make sure that our babies are doing it right, and having that conversation with them and seeing where they are and seeing how well they are receptive to the information. It just makes me proud that they are still willing to learn.
Mm-hmm. Awesome. So I want to just talk a little bit about that right there. Can you explain to us first, before I ask that question, my first question, or can you explain to us what tabling is? Because for those of us who don't work in the sexual health or social services environment, what is tabling? So how does that serve the community?
So tabling, say you go to a community fair or a job fair.
Okay.
You see tables of different organizations, different companies and stuff. That's kind of like what we do. We will have our pamphlets of our literature, the services that we have, educational things about what we provide as far as like medicine, PrEP, sexual health tips and things like that. We also have our own swag, our own cool knickknacks like bags, keychains, pronoun items, and fun stuff to like just gravitate the crowd to us. But tabling is really to go out to the community, get a chance to put ourselves out there and to be visible and to bring more foot traffic back to the house.
Awesome. Thanks for that clarification. So I do have another question for you. You said you go into the schools and you have conversations versus lectures with the young people. So how do you as a navigator get invited to the schools? Do you identify the schools? Do parents call you? How do you all determine which schools or how to go into schools, and what grade levels schools do you go in to have these conversations with young people?
Okay, so I'm going to start backwards with the questions.
That's okay.
The youngest that I've been around was 5th grade to high schoolers, 5 to 12. Each grade level are experiencing different things. So it's well needed within, the times of when puberty is coming about. How we are connected with schools and stuff, I believe that it's either we reach out to them or they reach out to us. I'm not really too informed on how we are connected with schools and everything, but there's a bunch of networking. When I go out into different events, I do come back with a list of people who do want to connect with Babashi, and I give them to my supervisor.
That makes sense. Okay. So you don't necessarily make the connections, but you do network when you're tabling or in the community, and you get lists that you pass on, and someone else does the scheduling, but you go out and you show up and you be present. And it sounds also like you said, so maybe middle school through high school, so 5th through 12th grade, young people, and you mentioned they have different needs. Can you give us an example? This is probably one of our tougher topics, but an important topic and a topic that's needed. Can you give an example of what might be a challenge, a sexual health challenge or issue that you have encountered with maybe middle school versus or 5th grade, like 5th, 6th, 7th graders where puberty is just happening, versus high school where they're in the thick of puberty? So what might be some of the challenges for earlier in the lifespan versus a teen and preteen puberty lifespan versus later, for our listeners who are like, what should I be looking for? What should I do? How should I support?
So it's definitely behavior. During one of my sessions of educating, it was like a couple of 5th graders along with the whole middle school, 6 through 8. The 5th grader happened to be the more active one, I should say. It was just the matter of not knowing the proper ways of consent and just being young. The child is active. And I don't know if they are using protection, care to use protection, So that's why we are there. We do come with condoms into the schools just in case anybody needs them. It's also like, if you don't need them, then give them to a friend that you may think who does. But I do see a lot of myths within beliefs, like with consent or how a session should go, how you should treat a lady or a young man or whoever you may choose to be with. Yeah, it's hard to explain. I don't want to say that they just got it all wrong, but it's just not done correctly. They're still immature about the situation, you know?
Sure. I mean, they're developing, they're growing, they're also experiencing puberty. And so this idea that, as early as fifth grade, we do have young people who are sexually active or engaging in sexual activities, and they may or may not know about how their body functions properly or even what consent means. And, unfortunately, there's so many headlines today happening where we hear about younger men and younger women who at the time were teens or young adults who have been taken advantage of. So this idea of helping young people to understand what consent is, right? This idea of helping young people to understand how their body functions, in addition to how to protect their bodies, are all important aspects of that learning process, it sounds like. And so,
that part.
Yeah.
And I will say, I do notice like most of the times the children aren't even worried about what can happen in between, what can happen afterwards of you doing a tango, but I see that kids within high school may be more knowledgeable about STIs and HIV other than those who are younger. They might hear BuzzFeed words, and not to say BuzzFeed word because every diagnosis is important for you to know your status about, but
Sure.
herpes, she's dirty, or HIV, oh, you have AIDS? Like, no. HIV comes before AIDS. You need to be not connected to care for a long period of time for your HIV to even develop into AIDS. And this is a temporary state, gotta get better. It's just the weakest point of your immune system.
Okay. So really helping them to understand not just identifying these diseases, but how these diseases progress and also what things they might need to do to take care of their physical health. It sounds like it's part of some of the lessons and conversations that you're having with young people.
Respect of you knowing your boundaries, your limits, and then as well as your partner, the matter of using protection, the matter of making sure if you are going to participate in these actions that you guys are doing it safe and in a respectful manner. And we also go into universities as well, where the situations may be different. And it will fall into, are you guys being safe about how you have sex in terms of with drugs being involved or drinking, going out and having hands and things like that.
Mm-hmm. So at each life stage, right? So from early adolescence to what we might call late stage adolescence, or as a developmental psychologist, the conversation is different, as well as the knowledge that the young people have about their sexual health and sexual health in general, it sounds like. So having said that and thinking about, just going and having these conversations with young people and just thinking about sexual activity as a taboo conversation. Historically, it's been a taboo conversation within Black communities or the Black community. So we know that there are many barriers Black families can face when it comes to sexual health education and care. So whether that's the LGBTQ plus community or whether that is a heterosexual community. So what are some unique challenges you see in your work, and how does Babashi help to overcome those areas for Black families and within the Black community?
Again, I would like to reiterate that, education is our top priority. It's where we make ourselves visible within the community because we are to teach people. We are to teach everyone and not just the Black community. Can't stress on how important education is. This is why I do my line of work, It also goes along with...
Makes sense.
There's a lot of things that need to start at home. And if not at home, it needs to be carried on. So, school and home, having that sexual wellness and health conversation. Not much is being taught within the class, especially with things changing from people getting comfortable with their identities and how they may have different sex than others, tagging on to those within the LGBT community and everything. It's just really that education. People got to have that knowledge.
Yeah. So, I'm an educator, so I believe in education and learning every day in every way. So thanks for that. And also about sexual health, I think is super important. And I do want to ask a related question in terms of, thinking about Black families and children. So how do you support children who may be in the LGBTQ community and might say, I'm in this space, but I can't necessarily have this conversation at home. Are there supports or resources that Babashi has available, or ways that you guide those young people who may feel like there's not someone that they can talk to about?
Definitely. We have yet to have our partnership with a mental health company to have licensed therapists under our roof. But my good old colleague is a really good investigator for referring clients to organizations or other therapy services that are a safer space for those within the LGBT community. So I do often find myself going to her and be like, hey, do you know any resources I can refer my client to? And then just giving the information and passing it along there. But yeah, we do have a resource book going from food pantries, clothing options, housing, mental health services, LGBT services, and so on.
That's so great. So how is that pamphlet available? Is it hard copy? Is it available on the website? How do people access that pamphlet?
So at first we had it as a big binder.
Big binder.
A big binder, yes.
That means lots of resources, which is a good thing. That's a good thing.
It is a good thing, but, I was just talking to another educator recently that, some of our resource guides need to be, what's that word?
Updated, revised.
Yes, updated. Yes, they need to be revised because there are some companies that will say or still show up online that they're open, and then you go there and then it's just boarded up in vines. Like, that is a devastating experience to have your client.
That's not good. Yes, that's not good at all.
Mm-hmm. So yeah, she has been revising our resource binder, and we're trying to make it to where they are pamphlets, or we can have a quicker access to give the resources to our clients because of our move. It's been different. We used to have a community board where we will be able to post those things up for anybody in the lobby to see, but we don't have that no more. We've been talking about it on how to make that change because even I have some clients within my caseload who is just like, we need the resource board, the community resource board and everything. And I feel bad because this is where they will find jobs. This is when they will find things to do when they don't have it,
Mm-hmm. Sure. So it sounds like, thinking about that, what are some of the unique challenges you see in your work as a community educator, and how does Babashi help to overcome those barriers? So it sounds like you've got this guide, you had a resource board, but are there other unique challenges that you encounter?
Maybe on a personal level, my client would be going through something that I don't know how to properly respond to. I think that is just a personal challenge, but that's why me and the prevention team, we work as a team. So I would go to a colleague and be like, hey, can you help me out? And I'll ask the client if it's okay if I do bring extra staff in to help assist. Other challenges that I may see that Babashi face or anything unique within the Black community is just, I feel like I see the same thing, not with everyone, but matters of needing transportation, the matters of needing access to food or healthcare. With our wellness clinic, it makes it easier for people to be seen other than going to their doctor where it will take
awesome.
Yes. Our wellness center is not necessarily like a clinic, but it acts as a purpose, and we do it. We hit them doors is moving.
Sure. Absolutely. Yeah. Absolutely. My doctor just recently said to me, it's time for your annual, but you need to get on the waiting list. I'm like, really? So I totally get that, unfortunately, that you may want to be seen by your doctor if you do have a doctor. And so the fact that they can at least come in and have the experience there is incredible resource that Babashi is offering. And so that resource, the wellness clinic, is also available for young people if needed.
Yes, so it's there for whenever we have somebody who needs treatment, there for those who get their vitals checked and then whatnot. But also, if anybody else is having any colds or sick symptoms and whatnot, they can be seen at our clinic. Not recently, but there was a time somebody got hit with a baseball bat, and it's just like, we can give you ice pack, but we're not an emergency room and everything. But we do more than just helping with prescribing medicine, helping with taking people's blood and whatnot.
One thing you mentioned this idea of, seeing things and, that schools and home need to work together. Home is the first place, even for formal education or traditional classroom education. So I wonder, does Babashi offer workshops to parents or to caregivers to help them figure out how to have conversations with young people, or to teachers and counselors at school to figure out how to have conversations with young people, or how to help young people to understand their own sexual identity, their sexual health? Does Babashi offer any of those kinds of workshops?
So since I've been here, I have not heard anything of such, but
Okay, put that on the to-do list.
yeah, no, because honestly, I would love to help, parents help out with their children and have that conversation. I wish that I had that conversation when I was younger. I had to go out and find and do the research myself. And, you will always want your partner, your parent, to be the one person you can confide into, that you can ask these questions.
That would be nice.
It would be nice,
right.
But sometimes people don't have that. So it will take for another person to be that guide. And, as long as they're getting the proper education, that's okay. But sometimes in cases that's not, if it's not your parent, somebody else could be teaching them the wrong things, which could lead into bad situations. You don't want to experience, but it starts at home. It starts at home. And I would love to pitch that to my supervisor.
Sure. So you can pitch afterwards, and you can have them listen to this this episode of the podcast and say, let's talk about this now.
She'll be proud of me.
She will, and get the creative juices flowing. I must ask, because I've worked directly with young people, and I know that sometimes, we can be surprised, and parents can certainly be surprised to learn or hear that their 5th or 6th grader is active, that they are sexually active and engaging in sexual behavior, and really not quite sure what to say or how to say it. So thinking along the lines of supporting the family as well as your initial clients or clients that come through the door, what might that conversation look like is so important, especially with the, can you give us an idea of what the current HIV AIDS numbers are within the Black community?
Ooh, I cannot, and I don't want to screw up and tell you just any number. HIV doesn't care about age, race, sex, or gender, but these are children, these are kids who have yet to experience life, honestly, and now they have HIV, and it's like, I'm glad that it's not the death sentence that it used to be back in the day. You take your medication, stay on top of your medication so you can be undetectable, but it still sucks that it has to start so early.
Sure. Absolutely. Yeah, it does, which is why I say, what do those conversations look like with the parents or the caregivers in relation to sexual health? Are there things that, if you were a parent listening to this episode of the podcast, or a caregiver, or even a teacher or a counselor, are there things that you would want them to hear from you, from Babashi, in relation to working with young people?
Yeah. The topic of sex shouldn't be a fear factor. It shouldn't be a fear factor. Just remember when you used to be them. You used to be the kids. Like, we all have once been horny teenagers, and we need to stop shaming the kids for having the same experience. We want to make ourselves safe for the kids to come to learn from, and to confide in, and to open up, and to not have the opportunity for someone with bad intentions to teach them the wrong things. So sexual health is also like beyond actual sex. It's teaching them what they need to know about their body, what is what, and how the different changes that they're going to experience.
Absolutely.
But when in doubt, use books. There's so many books to help have the hard conversations with your children, and the authors do best and handle that age appropriate things for you. Just meet them where they're at, and any questions let their questions guide you into the teachings as easy as possible. It's still going to be a bit difficult, but you can come see us at Babashi, and we can have the awkward conversations for you.
Sure. Are there any books? You said there are lots of books that you might say this is a good one to pick up and to help you just have the language that you might recommend to our listeners?
So I don't have any books myself. I would rather put together a list of books that are more so presenting to our people. We want this representation. So
sure.
I know on my own behalf, I did want to start looking up books for Black health, Black wellness, and all that stuff.
Sure. So. Absolutely. Books that are targeted toward the Black community.
There you go. When I get that together, I will be sending that to you.
We'll look forward to getting that from you. It's definitely important to see those books that are not only explaining sexual health and body and well-being, but also speaking to some of the challenges or opportunities within the Black community. So do keep us informed if that becomes part of the resources that Babashi offers.
Absolutely.
It's just so important to highlight the impact of this work that Babashi does within the community, and how you're thinking about what people might need to know, and what you've experienced when you're working with different groups of young people. Can you share any stories or examples of how Babashi's programs have positively impacted children's, teens, or families in Philadelphia? As we just said, can be a heavy topic. We don't want adults to shame children, but what are some of those positive stories that you can offer about Babashi and Black families and children in Philadelphia?
One of my favorite experiences with our boutique that provides clothes for those within the LGBT community and anybody else of need, specifically for those who just want to be themselves and don't have that safe space nor the clothes to provide that comfort. It makes me happy to see them shifting through the clothes and really just sharing how they feel so seen and truly being themselves in a non-judgmental environment. So that makes me happy with the closet, and hearing young people who know about sexual safety and consent is always amazing. I'm very glad to hear that sometimes within schools, it will be their own peers who will correct something said inappropriately or an action that just doesn't sit well with the atmosphere. So it's good that one, they're brave enough to correct their peers, and two, that they have the knowledge to be able to re-educate, those around them. But every time I talk with...
That's so good.
And it's like,
yeah, that's good.
I was concerned, but you got it.
Awesome.
But every time I talk to young people, it reminds me that the babies are okay.
Yeah.
So, and if they're not, then that's what I'm here for. That's what my job's for. I've been through it. I want kids to not go through the experiences that I went through. So, try to make the world a better place.
Yeah. So consent keeps coming up, especially when we're talking about young people. I just want to, before we move to the next few questions, how do you broach consent with young people to help them understand, like, no, what you think is consent in your fifth grade head is not consent. Consent looks like or sounds like or feels like or is this? What would you say to those young people to correct them around consent?
Yes means yes and no means no. It doesn't matter when the no is said, before, during, after whatever action. No means no and yes means yes. And when we talk about the sexual aspect of it, it's the matter of, like, if the person's not comfortable, you need to read body language. Sometimes they can be peer pressured into saying a yes, but if it doesn't sound like a yes, if it's not solid, then don't go with it. The best way to explain it, the best way that I've explained it with my coworker is that we'll put a pencil in somebody's hand and be like, take this. And they take it and be like, did you want to take it? Like, did you say yes? Did you offer your hand out? Like, no, that's not the way to go. There's different examples that we've used, but the simplest one is yes means yes and no means no.
Sure. Great. Thank you. I like that pencil example. That's something people can relate to. Like, it seems so simple. As you said, yes means yes and no means no, but really checking in. So body language, checking in as well is super important, helping young people to understand that that's part of it as well. Awesome. Well, thank you for sharing that. I think that can be simple, but also important. We might overlook that aspect of consent when we're thinking about
sometimes.
Yeah. And not just overlooked when people are engaging, but in having that conversation with young people. We're like, it's not just the activities that you may be involved in, but it's that consent, that yes or that no, that, reading the environment is equally important to being protective, being aware of your body and the body of the partners that you're engaged with. So thank you for that, Lori. And thinking that, the examples that you share with young people and practicing, I'm wondering, thinking that Babashi has this holistic approach. So you said, even the boutique being a space where people can feel whole and seen. Thinking about the food pantry. We love that Babashi takes a holistic approach and that you have internal medicine and you do have case management. I know you're working on the mental health, but at least you look to refer. I have to say that as a psychologist, thinking about that, right? So how does the integrated care model support long-term health outcomes, especially for families and for your clients who are navigating multiple needs, right? They may need to be in the food pantry. They may also need to be cared for in the wellness clinic. They may need mental health. So how does this integrated approach help with long-term health goals?
Well, we can't expect people to be on top of their health when their basic needs are not meant for their survival.
Yep.
When we do an intake, meeting a client, doing the necessary paperwork, asking the necessary questions that to get a gist of how we can better help them. We ask about housing, we ask about food insecurities, relationships, substance dependency, sex, the whole nine. But by asking these questions, we make it clear that we are not just here for medication, but for the betterment of their entire lives. We do try to have adults within the same family to have their own navigators.
Oh, great.
Yes.
Nice.
So that we're sort of being as thorough as possible for the one individual, but for the whole family, for whatever situation they may be in. But overall, we go as hard as we can for them every time. Once a person feels like they can take a step back, which is only slightly for their own survival mode, we're more than willing to be a long-term process and care of their needs for their medication and adherence and attendance for their appointments. But we're here.
Awesome. I'm glad to hear that, and that you try to have the resources for multiple members of the family so everyone has their needs being met. That's so important. So I want to say a couple more things before we let you go or ask a couple more questions. So one thing that I think about, you mentioned the food pantry, and you think about well-being and thriving and resilience, no matter what your status or your health is. As food, we know that food is an important part of the experience within the African-American community. So can you tell us what kinds of food you might find in the pantry, healthy food options? And I can say that having had a pack of gummy bears today. But those are my weakness. I crave them when I had my daughter. I was like, I need gummy bears and lo mein, but that's another story. However, but anyway, having said that, we are interested. We're thinking about, what are some healthy food options that might be in the pantry for folks who are on medication and need to make sure that they're getting good food. So
now with our pantry expanding, it's like a grocery store experience. Nice. I love it so much. We do have produce. We have non-perishables. We provide meat, fruit juices. What else is in there? Definitely vegetables, whether they're frozen or, on the racks. We have different ethnic meals. I know that for, we have beans, we have tortillas, starch for them to make the tortillas, cornmeal, peanut butter. I think we have some healthy snacks in there, like veggie straws or whatnot. I haven't been in the pantry in a while, but we
that's all right. I mean, if there's gummy bears, I will not be offended. It sounds like they are balanced out by all the other healthier items, but that's good to hear, right?
Items.
Yeah, healthier items, because sometimes, when people, need food in their food deserts, healthy items are not the option, right? We may go to the local stores and there are no quality, healthy food options. So the idea that you have that shopping experience where they can get healthy food options that also help to keep them healthy and resilient is awesome to hear. Awesome.
I would shop there, so I say.
I hear you. Well, thanks for that. One thing I had asked you earlier about the statistics for Black families and Black communities. And so I was just kind of took a quick look and I saw that looking at some 2022 stats, I'm sure there's something probably a little bit more updated. But it does look like, unfortunately, 39% new cases of HIV diagnosis were happening in 2022 for Black Americans or the Black community, compared to 24% for white communities, 31% for Latino Hispanic communities, 2% for Asian, and 3% for other populations. So we're still the highest in terms of new HIV diagnosis, which is not something we want to hear, which is, again, why the work that Babashi does is so important. We love that you work with young people as well as adults. We're looking forward to hearing, how the program continues to grow. So just wanted to have that. And, we're also learning that adolescents, unfortunately, Black adults and adolescents are really about 8 times higher than other categories in terms of HIV and diagnoses for the 2022 stats. So we want to be better, and we definitely want to be better among young people, as you mentioned, because they have their life to live. We all do, but certainly young people, there's so much that they don't know, but they may think they know. So we want to change those stats. We love that you take the approach of educating, going into schools, tabling, and all the other work that Babashi does. So thank you for that. And with those sobering statistics, it would also just be nice to hear. I know I asked you a little earlier, I asked you a similar question about, where would someone get started? What books might they read? But before we wrap up, before we let you go, I promise a few more questions only.
No rush. No rush.
Now, I know that we're asking you lots of questions, and this can be a challenging topic, right? But important information, and we want our listeners to think about having this conversation sooner than later. We want our listeners to figure out how to become comfortable, how to reach out to Babashi if they're in a local area next to where you're located in Philadelphia, Pennsylvania, or are there other organizations in their communities where they can begin to figure out how to have these conversations with their children, right, as early as 5th grade, right?
Yes. So I will say we have relocated. We used to be on 12th and Spring Garden in Philadelphia, and now we have relocated to 41st and Woodland to West Philly. Can't miss us. We're right at the corner of Woodland and Chester before you get to the Charlie station. We have our organization. I do know other orgs like us may go to a Philly Fight, Mazzoni. Who else is like us? I think it was Health One. Am I correct? Choice One, one of the two. There's a couple of other companies that I genuinely don't remember, but I know they're there. I know they're present.
Mm-hmm, mm-hmm.
Yes. I mean, not to be biased, if you ask, I don't hear many doing much like us. So
sure. They're not like us. You can say that. Hey. You can borrow from Kendrick. I don't think he's going to ask for a check. Yeah. I don't think Kendrick Lamar would be coming for a check unless he's donating to Babashi. Then we're happy.
We would love. Yeah. One-stop shop here.
Yeah. So before we wrap up, well, why did you all move? I remember your old location. I love that location for being convenient in terms of public transportation. So what prompted the move? Was it the larger space?
It is a much larger and colorful space, but that just allows us to have more resources and to assist everyone.
Awesome.
We have more testing rooms, which is great. Like I mentioned about the food pantry, it's much bigger than it used to be. I've had a couple clients who said they didn't even know we had a pantry because of how small it was.
Oh, wow.
Well, kind of crazy,
Well, that's good to hear. That's exciting.
And as far as the clinic as well, they have more rooms to assist each client and whatnot. But our old clinic on Spring Garden, because we had the office and the clinic, that is still standing. That is a satellite site, just in case, foot traffic from North Philly have yet to transfer over to West. And sometimes asking my clients or asking the people that I test, and some are closer to the north site and some are closer to the west site. So the two openings of the buildings makes it convenient for everyone.
So you've expanded. Well, congratulations.
We hope to expand more.
Awesome. Congratulations to Babashi and for doing such important work. We're so excited to have you join us and talk a little bit more about the work that you do and the work that Babashi does. So before we wrap up, we'd love for you to speak directly to our listeners. I know you and I have been chatting quite a bit, and I'm sure Sharita is going to miss being a part of this conversation. My co-host is also a developmental psychologist. While I have a 9-year-old, she has young adult teens, so she would love. I'm sure she would love to be here with us. So we're thinking about you, Sharita. But before we wrap up, we'd love for you to speak directly to our listeners, especially our parents and caregivers. So what advice would you give to those who want to begin having age-appropriate conversations with their children about sexual health and wellness?
Yes, don't make it a fear factor. Installing fear about a conversation that will stick with them for the rest of their lives will not be helpful. You don't want your babies going into a bad experience and having a bad experience. But I'll say meet them where they are. Meet them where they are, and I don't know. I can't say try to make it fun for them. I can't say I've had fun with my own education or whatnot, but definitely make it a safe space. Be comfortable to talk with them and not at them. Make it even if the child wants to come to you and share some things with you that you may not have known about, just be open to listening. We don't want to shut out our children. They need to be heard. They need to be heard. Something that I wish that I would have had growing up is the comfort. It is the freedom of speech. It's always knowing that I'm talking with who I'm talking to, but to still being able to let out whatever I need to let out. And, let them know that you still love them. Let them know that you're still going to be here.
Absolutely.
You don't got to be their friend. You don't got to be their friend.
Right. So one of our questions, and this might be a little more challenging for you, given the subject matter today. But we like to ask, what is like a joy factor? What's your joy quotient? What's something you do that you might recommend our listeners do with the young people in their life to really harness the joy? Like, what's the one thing you would say, do with your young people, which might contribute to that listening air? Or what would you say? What's that joyful thing you might recommend?
A joyful thing for a better connection between the adults and children?
Yeah, sure. Yes. So what's that one thing you might say, do, or something that you engage in that allows you to connect with young people that you might tell the adults, hey, try this. This might get you a good connection.
Well, I'm a silly goose. I can take things seriously and not sound serious. But with me being as closer to age than most may be, I think it's not really talking their lingo to try to walk the faith or talk the talk, walk the walk, whatever the thing may be. But it's really just be loose, be free, make it cute and funny. It works for me. So I would like to think it works for them. And it breaks the ice for those who may be uncomfortable with the conversation. But eventually they'll warm up because it's still a learning experience.
It is. It'll be learning for all of us, right?
Yes.
Yes. Well, thank you so much, Ori, for joining us and sharing your joy quotient. This is such important work.
Of course.
Our whole team, we are inspired by the ways that Babashi is showing up for families in Philadelphia and beyond. And, so this will go out beyond the city of Philadelphia. And so we're grateful for what you shared with us, and we express gratitude.
Yes, likewise. Thank you for having me. Even though I was a little nervous, I really enjoyed this. I like having this conversation.
Oh, good. So we hope that our parents are more and our caregivers are more comfortable and willing to have this conversation as well. And if not, reach out to Babashi and hopefully they'll help you and be able to give you that list of resources, that pamphlet to get you started having these conversations with the young people in your lives. And to our listeners, thank you for being part of the Raising Joyful and Resilient Black Children community. We are so grateful. This will be our final episode before we take a short summer break. We'll be back in the fall with the second half of season 3, bringing you more conversations that center Black families, joy, and wellness. In the meantime, catch up on past episodes, share with a friend, and follow us on Instagram at Raising Resilient Black Kids. Be well, and we'll see you soon.